righty. Hi there, everyone. My name is Pam Yankelove. I'm the Director of Research and Evaluation at the University of Louisville Trager Association or Institute. That was odd. Uh, we are doing this Project ECHO in partnership with the Kentucky Coalition for Healthy Communities, and we are very glad you are here. We're going to talk about the best practices of aging care. All right, just for some engagement strategies, we ask that you go on and keep your camera on, your video on at all possible. We do ask that you go on and mute yourself if you have a comment or you have a question. Please go on and raise your hand in your chat or even unmute. If you're having difficulty with your sound, just go on and click on the arrow next to your microphone to go on and test your system. We do ask that you go on and add your name and your organization to your little video square. You can do it in a variety of ways. You can do it by looking at the upper right-hand corner of your video square, and there's three little dots, and go on and click on that, and then rename is at the bottom of the dialog box, and you can name yourself there, add your pronouns. And then the other thing is that you can go to the participant list, which is in the bottom of your screens. And you can go on and click on that, find your name, and go on and add your name and your organization. It just helps us get to know one another in our learning community. So if you're unfamiliar with the University of Louisville Trager Institute, Republic Bank Optimal Aging Clinic. We are all about helping individuals optimally age. We are an institute about helping people optimally age through a variety of ways. We want to help individuals expand their health span and their lifespan. So we are focused on workforce development. We are a hub of workforce development. We train a variety of interdisciplinary learners, both as they're in their professional learning programs as well as after they graduate and move on into their professional lives. We focus on trying to change the knowledge, the skills, and the attitudes of individuals related to age-friendly healthcare and trauma-informed healthcare and lifestyle medicine. We are also engaged in clinical practice transformation, where we work with clinical environments, both non-traditional and traditional primary care, including your traditional outpatient clinic, as well as nursing homes and emergency departments, to engage in practice transformation to support individuals to optimally age throughout their life. And then lastly, what we do is we engage in community transformation. So many of us don't spend that much time with our healthcare professionals. We spend most of our time within the community. So the Traeger Institute is also focused on trying to transform our communities to be more age-friendly and help everybody optimally age. We are in partnership in this Project ECHO with the Kentucky Coalition for Healthy Communities. And I'm going to go on and pass the mic to Mona Huff, who's going to talk about the mission and vision of the Coalition for Healthy Communities.
Hey, thank you, Pam. And again, we want to welcome each and every one of you here. And our Coalition for Healthy Communities is a way that we can create community support systems for our adults. And we do that by partnership with the local coalitions and organizations in the area. We also hope to develop the workforce and concerned community members to empower our communities to become healthier. And we do that in a variety of ways, but one of the most known ways is by getting into our communities and teaching the diabetes self-management and the Flourishing Together classes. And then we also offer a Monday night education and support for just good health. So we'll talk a little more toward the end, but that's basically what we do.
Thank you, Mona. All right, as I indicated, the University of Louisville Trager Institute and Republic Bank Optimal Aging Clinic is focused on both lifestyle medicine, of which there are 6 pillars of lifestyle medicine. The idea is that food is medicine, and movement is medicine, and sleep is medicine, and avoiding risky substances, where we'll be focusing our energies today, and that stress management is medicine, and last, social relationships is medicine. We're also driven by the 4M framework, which is it's a framework that was developed by the Institute for Healthcare Improvement and the John A. Hartford, and it focuses on making sure that we're looking at what matters most to our individuals, making sure we check in on medication, mobility, and making sure our mood and our mind are being attended to when we're focusing on those areas. So those are the different tenets that we are driven by at the Traeger Institute. Here is our 2025 schedule. We're going to be talking about the unseen crisis, substance use disorder in older adults. In the November 21st, we're going to be talking about cognitive decline and dysphasia. And in December, we're going to be talking about the blue zones and healthy aging. So we hope that you guys come back to our November and December. If you're unfamiliar with Project Echo has been around since the early 2000s. It was developed by Sanji Arora, who is an MD and a hepatitis C expert. There are Project Echoes all around the world. And the idea of a Project Echo is telementoring. We're trying to move knowledge, not patients. He came up with this idea that individuals were driving 200 to 300 miles to come and see him for his knowledge as it relates to hepatitis C, and he didn't think that that was very efficient, nor was he creating the capacity. So he developed this telementoring platform, and the idea is that we push out knowledge to individuals via this platform, and we don't move our patients, we just move the knowledge. And so there's usually a didactic, then we talk about a case where it's a teach all, learn all in space, and we learn about interdisciplinary team-based care. There will be an attendance certificate that is provided. It'll be for 1.5 hours for today's session, but if you complete the evaluation, you can let us know that you would like to have an attendance certificate. If you are receiving continuing education, if you're a social worker or a community health worker, a certified community health worker, you must go on and complete the evaluation so we can get you that continuing education unit to you. Our continuing education is being provided by the Kentucky Office of Community Health Workers, uh, uh, which provides us 1.5 CEUs for certified community health workers. And Brescia University is also providing CEUs from the Kentucky Board of Social Work for individuals that are social workers. And so we thank both of them for providing CEUs. And today we have Dr. Samantha Cotton, who's going to be presenting on the unseen crisis, substance use disorder in older adults. If you are unfamiliar with Dr. Samantha Cotton, let me just share a little bit about her. So Dr. Cotton is a faculty member at the University of Louisville School of Medicine. She received her master's in 2012 and her PhD in 2018 from the University of Louisville, Kent School of Social Work and Family Science. Since that time, she was awarded the prestigious Geriatric Academic Career Award, also known as GACA, from the Health Resources and Service Administration, or HRSA. She's also the director of her Alzheimer's disease and related dementia program on Trager Institute's Geriatric Workforce Enhancement Program grant, also from HRSA. She has served in leadership roles in committees with the Kentucky Office of Dementia Services, and her compassionate curriculum is state approved as its required curriculum for several professional groups. She has given hundreds of workshops and presentations locally, regionally, and nationally on compassionate caregiving, age-friendly healthcare systems, and now substance use in older adults. Fun fact, she also speaks French. Merci beaucoup, Dr. Cotton.
You had to throw in that last piece, huh?
I had to.
Yeah. So good afternoon, everyone. Thank you all for being here. In addition to all those lovely things Dr. Pam just said about me, one of my other we talk about side missions in life, in addition to my work with all persons with Alzheimer's disease and related dementias, is actually within the space of working with individuals with substance usage disorder. And I think when we start talking about older adults and substance usage disorder, I like to really focus on this idea of it being an unseen crisis or an unseen problem within society, because often when we think about substance use, we often picture a younger demographic, but this is really a serious and growing issue that really necessitates us having these types of conversations, and really thinking about it from the lens of compassion as well. So, throughout today, we're going to talk about really some of the things related to not just older adults, and their challenges in this space, but also the way in which we deal with it and some of the ageism that's prevalent, and sometimes the lack of compassion in the way in which we talk about this particular topic. So, for a very long time, substance usage disorder was really overlooked, both in the medical field and also in the mental health field as well. But we're starting to see some significant demographic shifts when we talk about the older adult population as well. The generation that's now aging, that's sort of fitting into that category, is our baby boomer generation, and they have just a different history with substance use than previous generations. When we get into prevalence rates as well, I think, that also speaks to sort of this unseen crisis because largely, think about when most individuals go to even their routine primary care appointments, there's always that question about substance misuse or substance use in the form of alcohol use or drug use. And most individuals do not always answer that accurately. And a lot of that also has to deal with that sort of stigma and shame. And we're going to get into some of that today as well. I also think when we start talking about this being an unseen sort of crisis or unseen problem within the older adult population, it's largely been overlooked because some of the symptoms of substance usage disorder in older adults, specifically those things like memory issues, falls, depression, those are often erroneously mistaken for other age-related medical, cognitive, or psychiatric conditions even. So sometimes it's often ignored or misdiagnosed for that reason. Again, one of the other things we're going to talk about today is this kind of concept of stigma and ageism that's really prevalent as well. And there's sort of this perception that drug addiction or substance misuse or use is only a young person's problem. And this kind of ageism that's sort of prevalent in the way in which we talk about substance misuse really contributes to stigma and shame. And so that makes older adults often feel like they don't want to seek help or be very honest or transparent. And also, because of some of those misconceptions about substance misuse, what we see is that there's a lack of screening and assessment that happens in this space. The other thing is substance usage disorder can develop later in life as well. An individual might not have had challenges with substance misuse earlier in life and then develop that over time as they get older, particularly in response to things like major life transitions. So things like grief, loss of a spouse, loss of purpose, loss of independence, perhaps. And so when that happens, what we often see is that an individual might actually try to hide or conceal their substance misuse. And so, again, these are all things that we need to be aware of in talking about this topic. And I highlighted earlier the baby boomer generation, which are those individuals who were born between 1946 and 1964. They're currently moving into that older adulthood kind of category. And this particular generation, it's quite interesting when we talk about substance usage disorder or substance misuse, because they've brought really a different history of substance use in general compared to previous generations. This is the generation that grew up during a time when there was more widespread availability and acceptance of various substances, particularly things like cannabis. And their higher rates of lifetime substance use means that, naturally, as they age, the prevalence rate of substance usage disorder is increasing in that demographic. They are more likely to have a history of use that continues and or in some situations reemerges later in life. So let's look at some of the substances that are most commonly involved when we talk about substance usage disorder. And let's start with alcohol, because I do think when we talk about that, a lot of times because there's such a societal acceptance of drinking alcohol that we often sort of dismiss it as a problem or a challenge. Um, but for our older adult population, because of a number of different reasons, alcohol use disorder is really a major concern that we should be paying attention to. And I should step back and say some of you who are joining us today might be professionals working in the field. Some of you might be community members. Some of you might have came today because you have a personal connection to this topic. And I think regardless of what your reasoning for coming or your role in what I just discussed, it's important for you to sort of understand some of these different areas because if you're working with someone or you're caring for someone who's dealing with this, it's important to sort of better understand some of the complexities here, especially related to these different substances that we're talking about. And with alcohol use, what we see is that there's several very distinct and heightened risk for older adults. And this is in part due to some of the physiological changes that we see with older adults, and also in some situations, depending on who the person is and what all is going on with them, sometimes we see complex medication regimens as well, which sort of contribute to this. Due to, as we get older, the fact that our body's physiology is changing, things like the reduction of or reduced body water and lean muscle mass. Alcohol sometimes has a more intense effect on things like the central nervous system. So this can mean that the older adult can feel intoxicated more quickly or after consuming less alcohol than when they were younger. And this can also lead to some worsening chronic conditions over time as well. We do know that alcohol significantly increases the risk or worsens different chronic health conditions like congestive heart failure, diabetes, liver problems, and in addition to that, alcohol can also exacerbate existing cognitive decline and memory issues as well. Um, Perhaps, when we're talking about alcohol misuse as well, and just sort of looking at the full picture of everything, I think one of the most critical things that we have to sort of consider as well is the potential for these dangerous interactions with numerous prescription medications an older adult might be taking, even over-the-counter medications. So I'm thinking about, an older adult who might be, maybe they're not taking Benadryl every day, but they're taking it on a regular basis because maybe they've had an allergic reaction to something, or they have hives or some sort of allergy that has contributed to them taking that. That the interaction with alcohol is going to heighten the effects of both of those medications. So when we talk about alcohol use disorder, it is a concern in this age group, and it can also be a risk factor for an individual in many areas, things like falls risk, medication mismanagement, or again, in general, some of those cognitive related challenges that we're seeing. Um, With cannabis, what we're often seeing with older adults is this increased use. And this trend has really been driven by several factors. I think, now this doesn't really stand in Kentucky, but if we're looking across the United States, the changing legal status of cannabis, so the legalization of medical and or recreational use in many states, the shift in perception and need within the demographic of older adults as well for various medical purposes. We're seeing often older adults might look to using cannabis for things like chronic pain or arthritis pain, where they want to avoid something that they consider to be more addictive, like opioid medications. Sometimes individuals might be using it for sleep or anxiety or even cancer related side effects as well. This can all be very common for individuals. But regardless of that, it's important for us to understand the risk in an individual overusing cannabis, even in these specific areas where they might have received some guidance. So we see things like increased risk for falls because we do know that cannabis can cause things like blurred vision, dizziness, impaired balance, coordination. For some individuals, it does have the potential to cause paranoia and heighten their anxiety as well. Um, the other thing to be aware of is that, for a lot of our older adults, especially those who might have been users of cannabis when they were much younger, a lot of the products that are on the market now have much higher THC concentrations than in the past. So the effects might be stronger for them. And so the potential for side effects or ongoing challenges might be um, problematic for them. So this really shows us this need for screening and not to assume that our older adults are not using cannabis, and also to educate them about some of these risk factors. Now, the last specific category I'm going to talk about here related to substance misuse is going to be prescription pills. And I arguably think that this might actually be the most complex and dangerous when we talk about substance usage disorder in older adults, primarily because what we see is often that misuse begins unintentionally, or sometimes it can happen in response to a legitimate medical need. So, for example, individuals who are prescribed opioids for chronic pain, we do know that opioids have a high addictive potential as well. Individuals who might be described or might be prescribed benzos, which are often used for things like anxiety, sleep, those can lead to long-term dependence and have some potentially dangerous withdrawal symptoms for anybody, but in particular for older adults as well. And then using these medications in conjunction with other medications that an individual might be prescribed can sometimes have that, again, that heightened impact on the central nervous system for the individual. So, really challenges in that space too. Um, again, when we talk about prescription medications, that's often difficult because, again, sometimes individuals have legitimately been prescribed these medications for one reason or another. And so it's hard to sort of pinpoint exactly when they start struggling with the substance misuse. A lot of times this is found out, by the fact that, they're calling for a refill of their prescription sooner than they really should be. And again, this is something a lot of older adults really don't like to talk about. And what we often see too is that with substance misuse that's starting or worsening later in life, it's often with these major life transitions that come with aging that really contribute to this. So I'm talking about things like grief after the loss of a spouse or friends, this sort of overarching feeling of a loss of purpose that comes following perhaps a retirement or a different type of change in one's life, where they have to maybe move to a facility, for example, if they're no longer able to manage what's going on in their own home themselves independently. We also see things like loneliness and boredom are incredibly powerful stressors as well. And all of these are really risk factors that can really, contribute to an older adult developing or worsening a substance use disorder. And beyond life transitions, there are medical risk factors as well. Things like chronic pain is a major factor, which often leads to that initial use of prescribed things like opioids. The use of multiple medications, even prescribed medications themselves can all heighten the risk of misuse and dangerous interactions. And these risk factors really can lead to very specific and dangerous challenges for older adults with substance usage disorder. We see a risk or an increased risk as it relates to medication mismanagement, which means that an individual might be confusing their doses, or they might be having interactions of all their different medications. Obviously, the more medications an individual's on and they're really struggling to manage all of this, and if you combine that with their use of um, um, for example, opioids or misuse of alcohol. This does put them at more risk for overdose. And also, the changes that I mentioned earlier, things like changes to metabolism as we age, can be a problem for older adults. And all of this, all these different medications that I've discussed, or sorry, substances that I've discussed so far, can really significantly heighten falls risk, which can lead to life-threatening injuries and or for some individuals contribute to them having hospitalizations and or having to transition to rehab for, whatever happened as it related to their fall. And really, just to recap, I think it's important for all of us to really have sort of this understanding that when we talk about, substances, that all of these, especially if somebody's misusing them, can have a heightened risk for the older adult, and really contribute to overall decline in quality of health and quality of life in general. So that brings me to, I think, an important concept when we talk about substance misuse in older adults is this idea of stigma and shame. These really represent some of the most formidable non-clinical barriers, I think, to individuals receiving the care that they need. Within the medical field, within the mental health field, I think we've done a lot of work to get to the space where we really do recognize substance usage disorder as a medical condition, not a moral failing. But we still see quite a bit where, these sort of societal conceptions or personal perceptions lag behind sort of that way of thinking about this as a medical condition. So what we see with older adults in particular is that they may have grown up internalizing the idea that addiction, in particular, any type of addiction, is a sign of personal weakness or moral failing. And so this can really be evident for the older adult where the substance usage disorder has developed later in life to a response to some of these challenges that I've discussed. So they might feel like they failed their family, themselves, they might be reluctant to even admit that they have a problem. And so that internalized sort of shame that occurs for the individual really kind of drives their use, sort of what I would quote unquote underground. They might isolate themselves from friends or family. They might be really trying to go above and beyond to conceal their misuse. And ironically, this isolation, the self-imposed isolation that's stemming from their shame, really exacerbates or worsens the problem for them long term. The other thing, when we start talking about stigma and shame, is this idea of ageism. You can go to the next slide. Um, a lot of times when we talk about addiction in general or substance misuse in general, we talk about it as a young person's problem, as I started off today by saying. And so that really compounds the shame of the older adult, like this shouldn't be happening at my age. They might feel as though, this is a young person's problem and internalize that, making them feel like they can't go and seek help. I think that perhaps the most damaging form of ageism that we often see, though, comes from us as professionals. And it's this idea that, people his or her age or their age don't really benefit from treatment. So why are we even assessing or screening for this? Or that it might be too late to change. And we know from research that's been done in this space with older adults and substance misuse that treatment definitely works. Older adults tend to respond very well to age-appropriate substance usage treatment. They often have better retention and success rates than younger populations. But this myth sometimes contributes to individuals not getting referred to the treatment that they actually need. So it's really important, I think, for us to normalize the conversation around substance misuse, to really use person first language. I am one of those people that I think words matter, and the words that we use to describe people in general have such a huge impact, even on the way in which we treat them, whether we're, whether it's conscious or unconscious sometimes. So, in talking about substance misuse, it's really important for us to use person first language. because this really does affect, again, the older adult who's dealing with this, but it also, again, it affects our perception. We tend to treat people differently as a result of the way in which we hear these words associated with them. So instead of calling someone an addict, an alcoholic, a junkie, we should rather use person with a substance usage disorder, or if you want to get specific about it, if somebody's dealing with alcohol use, alcohol usage disorder, or a person who uses drugs. The reason for this is really because that those shaming terms imply that the person is, defined by their illness. They're just that, they become just that, and not all these other things, right? And so we really want to use this person first language to respect their inherent dignity. The other things like, using words like dirty, habit, these are all problematic for a variety of reasons. For example, when we talk about habit, that really sort of minimizes the complexity of the illness that they're dealing with. Things like abuse really frames it as a moral failing, whereas disorder really does kind of tap into the fact that this is a true medical illness. So using words like that can be much more helpful. The other thing, like former addict, that can really be not very much focused on this whole journey that that person has been on. So using things like person in recovery or long-term recovery can be much more beneficial for them long-term. So how do we help? How can we help in these situations? Again, regardless of the role that you're playing in this person's life, I think that we all play a part in this. It really does start with, focusing on the way in which we talk about this. It also starts with us being aware of the fact that, older adults can really struggle with this, and they might be reluctant to have these conversations. So really putting yourself in that space to pay attention. So if you have a loved one who's you suspect might be struggling, thinking about what are those ways you can help them. Thinking about, again, just your language that you use, right? Setting that example of, we are much more than just this one condition that we're dealing with. So really using that person, destigmatizing language as well. And for those of you who've came to other Project Echoes I've done or other workshops I've done, you know that I love a good practical, tip that you can use in any of these types of situations. And so, in looking at this, really thinking about if you are trying to have this conversation with either a patient or a client or someone a loved one even, really thinking about being deliberate in the way in which you approach that conversation. Because again, these aren't easy conversations to have. So you do want to talk in a calm, sober environment. Make sure that that person's not intoxicated. Sometimes if the person is intoxicated or, high in those situations, it's only going to lead to more frustration, more conflict. Make sure you use I statements. If you're trying to express your feelings or your professional, if you're in a professional setting, your professional observations, you're going to want to say things like, I'm worried because I've noticed, or I'm concerned when I hear you say this. Don't just necessarily, say you did this, or you're an addict, things like that, because that's going to be problematic. The other thing is you really want to make sure that you focus on that person's values. Really frame the conversation to help tie in what matters most to them. Things like their health or their grandchildren or even their independence can all be important. Try to avoid, digging up, these painful things that may have happened in the past and really focus again on the current impact that the substance misuse is having on that individual. And, I think the most important thing when we're talking about, providing care to older adults who might be dealing with substance misuse is this idea of compassion. Not really, really coming at it from that standpoint of you're not really looking down on the person because of what's happening. But really making sure that you're walking that journey with them and approaching this issue with understanding, respect, and non-judgment. And that's really the best way that we can help the older adult find the path for recovery. And I'll put this in the chat, but SAMHSA does have a lot of really great resources in this space as well. So if you're working with someone and you're looking for a treatment center, I think this is a great starting point. And I always include this because, in particular, I know in our rural areas, sometimes knowing exactly, where resources are is important. And I think that's actually my last slide. So I'll put that in the chat and um, thank you for listening. And I want to just pause here and see if there are any questions.
I think we have time for maybe one question or one reflection. I think we have a case today that's really taps into the work that you put together for us, the information, and I think it'd be really helpful. Hope you can stay, Sam, throughout it. Oh, that's right, you are. You're going to be
Yeah, I'm going to take recommendations. So.
right. So there are a few questions coming in. Let's see.
Okay. So, Crystal, age appropriate care look like? I think one of the things I can suggest here as it relates to that piece is a lot of times for substance misuse, individuals really do benefit from group settings where they're able to talk about their experiences and really hear from others who are on that recovery journey. But that for an older adult, if they're going and everybody in the room is, 20 years old, that's not going to necessarily be helpful. They're not going to always find commonalities in what they're going through with what that person is going through. So, looking for more age specific. And age specifically, if you're looking at groups, age specific groups where maybe it is for a 50 and older population or 60 and older population, those do exist. And I think older adults would benefit by being with their peers more.
Yeah. And Justin has a question for you. And
Substance misuse disorder. Okay, so when you talk about that, there are assessment tools, that mental health professionals, that medical professionals can use to look at that. There are a number of different cutoffs for each of those areas. I didn't get into that so much today, mainly because there's different areas you can look at. There's an opioid screener. There's one that's focused on alcohol misuse as well. In general, I would say that regardless if we're using the word disorder or not, if a person's substance misuse is impacting their daily life, right? And it's prohibiting them from being independent if it's exacerbating some of their medical conditions, that's always going to be a starting point for them seeking to get help.
all righty. Thank you so much, Sam. And I think we're going to transition. Sam's going to take our recommendations for us. We're going to transition to our case now. I believe we have Michael is going to present. Let's see, oh, is Michael here? You can go in and turn on your mic.
Yes, thank you so much. Oh, great. Okay, I didn't see that someone will be presenting it. Thank you so much. So yeah, my name is Michael Beeler. I live in Washington State. I am a social work student at the University of Louisville. And today I'll be presenting on one of my clients that I've been interacting with. This client, I'll read through here. The client is a 53-year-old male. He works full time. He works overnight shifts. And he has been known for accepting overtime shifts as well. Despite his steady employment, he is 2 to 3 months behind on rent, and he has experienced food insecurity. He reports good overall health, but struggles with severe fatigue, depression, anxiety, and heavy alcohol use, which may be connected to unresolved grief over the loss of his wife 5 years ago. His main goal is to improve financial stability and overall well-being. So the questions that I'm looking to help get answered are, what are some practical ways to help this client get back on track financially without overwhelming them, especially considering their work schedule and their mental health? Question two, what are some effective approaches for helping clients who use alcohol to cope with stress or grief while keeping the conversation supportive and non-judgmental? So as I mentioned, my client is 53. He's a male. He identifies as a male. His living arrangement, he lives in an apartment with his child. We haven't discussed too much about his child. He's mentioned that she's in and out of the house, so I'm suspecting that she's anywhere from maybe a teenager to maybe a young adult. One thing that I didn't mention in my presentation, my slides here, is that I mentioned that he's widowed. His wife had three other kids from somebody else. And so he occasionally will see the other kids from time to time, um, but he has limited contact with them. His primary diagnosis here, he does have type 2 diabetes. Um, he has high blood pressure, high cholesterol, and a mixed anxiety and depressive disorder. And of course, he has the continuous non-dependent harmful pattern of alcohol use. Um, his clinical measures are as of August 25th, so he has recently been to the doctor. His height is 5'8". He weighs 146. His BMI is 22.2. Um, his blood pressure, I missed that, but I have it on my end over here is 135 over 89. That's just a little typo I missed there. His LDL 102.4, HDL 83, and his A1C is 6.6, which is fairly high, showing that he does have the type 2 diabetes. So, my client here has reported severe fatigue and limited daily activities. A lot of that has to do with the fact that he does work overnight shifts, which has led to for him just being extremely tired and getting lack of sleep. He works 312s and occasionally he will put in additional shifts. So he works a lot. He's definitely keeping busy. Cognitively, he is alert, but he's mentioned that he does struggle to focus due to his fatigue and high stress. So some of our key symptoms include him just being tired, being in pain, having problems sleeping. It's noted that he does take his medication for diabetes, his hypertension, and cholesterol. I haven't actually discussed that with him. We have some other things that we're talking about that I would eventually like to kind of see where he's at as far as taking his medication goes. Um, and he also has reported erectile dysfunction. His nutrition has been compromised due to his food insecurity and limited access to healthy meals. Those are some of the things that I would like to work on next with him. But with his financial situation, it's more important just to focus on getting him access to food first before we start focusing on addressing other issues. My client does hold a GED and he does maintain full-time employment. So that does demonstrate that he has consistency and motivation despite his financial challenges. One of the things that I've been trying to work on with him is that he is behind in rent and he has been unable to afford some of the basic necessities, including food. So those are areas that, yeah, like I said, we're definitely focusing on. Before I move into things like the client he does not have an advance directive or a power of attorney on file. Those are things eventually that I'm hoping to work with this client for a while so that we can go back and kind of work on some of these things that might be important. Now, he does own a vehicle. But one of the things that he's complained about is that his financial situation is very limited. So he is unable to afford gas. And so that kind of makes it a little bit difficult for him to get to his appointments or to work. I think he mainly uses the car just to and from work, and that's it. So one of his biggest stressors is really just his economic stability and improving his financial situation. Um, he has reported heavy depression, anxiety, and stress, as well as heavy alcohol use to cope with his emotional strain and fatigue. Um, we've talked about his heavy alcohol use He's reported that when he does drink, he will drink anywhere from 4 to 6 alcohol beverages during a single time. Um, he identifies as an African American man, and he does value his family and his faith. And he's talked about connecting back to his church community, but with his schedule, he works weekends primarily. That's his set schedule. So he has a really hard time attending church services. Um, and of course, like I said, he works overtime too. So his schedule is it's really hard for him to seek community support. As I mentioned, the client is widowed. His wife passed away from an asthma attack 5 years ago, and he is continuing to process that grief related to her loss. As I mentioned, he has his GED and he maintains his full-time employment. Um, he lives with his daughter, but as I mentioned, she's in and out of the home, and he does maintain a very close relationship with his mother and his sister. He's mentioned that his mom and sister tend to call him like almost every day. And so he does have a very strong support there with his mom and his sister. Just getting that emotional support I can tell, has really helped him because although he's got these really struggles, he is aware of what he's struggling with, and I can tell that he has that passion in him, like he's not giving up, like he knows he needs to do things, but he's just using coping mechanisms in ways that might be suppressing some of his abilities to further propel himself. You can go to them again. Thank you. Um, so as I mentioned, the client does report drinking alcohol about 4 days a week. That's because his days off are Monday, Tuesday, Wednesday, and Thursday. But like I said, he does pick up overtime shifts. So he's got some time off, but he's still pretty overworked. So I think that gives him the ability to just start focusing on things that might be a little unhealthy. He has admitted that drinking alcohol does help him unwind on his after his overnight shifts to cope with his stress and fatigue, but he's also recognized that it's become a habit that he would like to change. It's not reported that he smokes or illicit drugs. I haven't really discussed a whole lot about that with him, but due to his demanding schedule and constant fatigue, he does not engage in physical activity outside of work. Um, his eating habits have been quite inconsistent. Sometimes he's mentioned that he skips meals or he'll rely on quick, inexpensive food just because he's in a time crunch or he's unable to afford healthy meals. So access to fresh and healthy options has been quite difficult, especially with his financial strain. He does take prescribed medications for his diabetes, hypertension, and cholesterol, but he has reported that he struggles with staying consistent, especially with his sleep schedule being off and or if he's working way too much. He does have access to regular source of care. The client has a primary care provider, and he has attended his PCP. He's seen his doctor within the last 6 months. Um, Now, I said no to access to medication, and that's mainly because he has reported struggling to afford some of the prescriptions. So that has certainly affected his consistency and medication use. He, he does not have access to mental health services. The client is not currently connected to counseling or therapy. I've I've been working with him on this, and I would really like to get him connected with a student therapist. And I've been working with the student therapist, trying to find some time to schedule an opportunity to meet, discuss this. But the couple times that I've mentioned about seeking therapy, he seems resistant to it. It doesn't, I don't feel like he's ready for therapy quite yet. I think he certainly could benefit from therapy. So maybe it's not that he's not ready for it, but I think he's not willing to accept it yet. Uh, his overall satisfaction with care, he he reports being generally satisfied. He's mentioned that he's never had any suicidal thoughts, nothing to the the significance that would lead him to make any decisions that might be impactful. Um, but he generally mentions that he feels satisfied, but he just wishes that he had more support for emotional and, of course, financial challenges. He struggles with his financial challenges. Um, he is no, he does not. We haven't talked about dental care. The client has not reported any recent dental visits, but this may be just because he's unable to afford it, and his financial barriers have limited, I'm sure, and of course his overnight shifts. We haven't talked a whole lot about his fall hazards. Um, he hasn't reported on any fall hazards in the home, but he does talk about moving around independently. But yet he does experience fatigue. So he's able to go to work, but his fatigue here could increase his risk if his fatigue is not addressed. Smoke detectors in the home, that's unclear. This has not been discussed with the client, so safety verification is needed. The home hygiene is also unclear. The client has not mentioned the condition of his living space, so I feel like further assessment is recommended. Um, I guess I might have had that twice in the personal hygiene, home hygiene, I'm sorry. Personal hygiene is also unclear. We have not been able to discuss this. But there's no current concerns that I'm aware of, but they should definitely be confirmed. Carbon monoxide detector is also unclear. The client has not been asked about the carbon monoxide, but again, that should be verified. His stress environment, the client's environment can be stressful due to financial strain, long work hours, and of course his limited rest, which may be impacting his physical and emotional well-being. In his holistic assessment here, the his PCP manages his diabetes, hypertension, and cholesterol. The benefit is that he does have consistent medical oversight, like he has been to his doctor within the last 6 months. His challenges are that the fatigue and work schedule limits his ability to have follow-ups. Pharmacy does provide the medications and refill of support, of course. The benefit, he's got access to prescriptions and education, but the challenge is that he has the cost barriers that delay perhaps his refills. A case manager, that's my role here. I am doing my best to coordinate care and connect him with food, housing, and financial resource support. This has allowed us to build some trust and but I have been having some difficulties. So he's mentioned that he's picked up a couple shifts on Wednesdays and Thursdays, and so there's been situations where I've tried to reach out to him. We will make a scheduled time to meet, and he has not answered his phone. I've been trying to use other methods of communication like text messaging, and then I received his email address as well. So there's been a little bit of struggle with communication. We've been able to talk on the phone a few times, but there are many times that he's also had some no-shows that we've had to reschedule on. He also his mother, sister, and daughter offer him emotional and social support. So he does have that nice, strong family connection, but he also has very limited time together due to his schedule. And of course, his daughter is in and out of their home. His behavioral health for depression, anxiety, grief, and alcohol use. Um, he could improve his coping and self-awareness, but the client is hesitant, and he does work on the weekends, which makes things a little bit challenging. These are his medication list here. I'm not going to go through too much of them. This is an area that I don't have a whole lot of experience in. So, and then we haven't really discussed a whole lot of about his medication either. We've been discussing more about what we can do to help with his finances. So, yeah. So, yeah, my questions were. What are some practical ways to help this client get back on track financially without overwhelming them, especially considering their work schedule and mental health? And what are some effective approaches for helping clients who use alcohol to cope with stress or grief while keeping the conversation supportive and non-judgmental?
All right. Thank you. Thank you so much, Michael, for that very comprehensive overview of this particular client.
Yeah, and I can address some of these questions. Can I create a budget with him? Absolutely. I think that would be a great method, certainly.
Has there any, has there been anything that has happened in the last few months? I mean, has he been consistent with rent? I mean, you said
Um,
I'd
yeah,
like
that's
to
a very good question. So I have not been able to reach him. Last week we had a follow-up phone call, and I was ready to discuss some of those, but he was unable to answer his phone. And I am a little concerned because he was 2 to 3 months already behind in rent. And so I'm very concerned about what might be going on at this moment. Um, he's yeah, I mean, I'm a little unclear about what's going on at the moment with him because of his being behind on rent. So I think he might have received a notice of some sort that he's trying to address.
yeah, just leaning into some of those circumstances. I
Yeah.
think that he's seems to be pretty stable in his employment for the last several years.
Yeah. Yeah, he's quite consistent with that. We haven't been able to discuss a whole lot about um what his typical routine looks like, because that's something else that I would really like to focus in on is like try to establish like he talks about g going to work at night. I believe he said he starts work at like 8 p.m. And so I would like to try to establish some type of a routine. And somebody mentioned in the chat there about creating a budget of some sort for him. And I think that's I think a budget would be very helpful as some type of a routine. Um,
And can I add something to that? It sounds
mhm,
like, so when you talk about his substance use,
mhm.
it's almost like that has become part of his quote unquote
Right.
routine. And
Yeah.
typically that's what we see, right? You get into patterns of doing the same thing over and over again. And
Hmm.
so with substance misuse, sometimes it can be hard to break out of that routine because
Yeah.
naturally, I think all of us, regardless if it's good or bad, we end up in these sort of modes or patterns
Habits.
of doing the same thing, right? And so, one, keeping that in mind and thinking about how can we shake up that routine a little bit with him to replace the drinking with a better coping mechanism. The other
Yeah.
thing I would suggest doing as well is when you talk about, and this goes across the board, when you talk about substance misuse, people will tell you, oh, I have 4 to 6 drinks or I have 5 to 6 drinks every time I drink. But sometimes that's n- not completely accurate information because the person
Mhm.
is not telling you what they're drinking and or how much. Like, what is one drink? Like, for example, I think this is, my water glass is like a 16-ounce glass, right?
Right.
That's going to technically be more than one serving of alcohol, right?
Yep.
So, it really does. We do sometimes need to do a deeper dive to better understand, especially when you're talking about alcohol misuse. We really want to be careful about withdrawal symptoms for
Mhm.
individuals as well, because those can be particularly problematic. And so really thinking about, okay, assessing how much is the person actually drinking?
Yeah.
And two, is there a way for us to think about working with him using that motivational interviewing approach to kind of figure out what are those anchors, how can we replace a better coping mechanism, with what he's doing currently. And then also thinking about even just, for a lot of individuals, it's not sustainable right off the bat to say, I'm going to quit drinking altogether. Right. Especially when they've been drinking that, excessively, for example.
Yeah.
So what does that reduction look like for them?
Yeah. Yeah. No, I think that's a great approach. I think maybe focusing on, I would like to find out how much he does drink because that's a great point right there. He mentions he drinks 3 to 4 beverages when he does drink, but what exactly constitute as a beverage? Um, because he could be doing so much more. So, I mean, there's a lot of things that I feel like this guy has a lot of areas that I can definitely work on. And I think he's overwhelmed and he's unable to focus on some of these things because I think he's stressed out with his financial situation. And so I think that's making it a little bit difficult for him. But
Fatigue
yeah,
and focus can also be a function of his diabetes, the alcohol, and the lack of food. If
yes.
you have long times without
Mhm.
eating food, that can also affect like ketoacidosis. There's such things as like starvation
Mhm.
ketoacidosis that can really affect your focus, your fatigue. And he's not
Yeah.
go high or low as it relates to that on his glucose. Even his glucose could actually look okay and he could still be in ketoacidosis. So
And alcohol is not going to help that,
it's
right?
Yeah.
That's
not
going
gonna
to exacerbate some of those issues.
Hmm.
Yeah.
but even
Yeah.
And Michael, I think part of the beginning conversation may be something around why do you think you're having the financial problems?
well,
Yeah.
Because I think you're going to find out that he's spending a lot more on alcohol than he even realizes.
uh,
Sure.
Then, like Sam said, with the motivational, what happens if I reduce that? And, how can that change my life?
Yeah.
And give him a passion toward the change rather than stopping the alcohol.
Right. That's a great approach because I don't want to I want to support him without telling him that he needs to stop. I want to essentially work on this in a set, let him have his coping mechanism. Everybody needs something to rely on. And maybe in the future we can slowly reduce his intake. But yeah, thank you.
And he may
I
be to
wanted
the point,
to, I'm
oh, I'm
sorry.
sorry. He may be to the point where he needs medical intervention to be able to quit,
That's
but
true.
yet it takes time.
Yeah.
Sometimes the slow approach works for people, sometimes it does not. But then that's when they need the medical intervention. They
Yeah.
can't just stop cold turkey.
Yeah, you need to be very careful on that piece. I always
That's
caution, like,
right.
you need to have involvement on this piece, not
Okay.
just be like,
Yeah.
"Oh, quit." I think a lot of, and this happens quite a bit. I've seen this happen with family members saying you must stop, and like giving the person the ultimatum that
Yeah.
you have to stop now. And
Yeah.
that if you've been excessively drinking for a long time, that's not going to be helpful.
Right.
Mm-mm.
Ugh.
yeah, I think Chris and Shane, I think it was Chris who spoke next. Was it Chris? Did you have a question?
Actually, it was
Yeah.
Bev.
Oh,
Never mind.
okay,
I
sorry.
sorry. Yeah, I didn't see it. I see Melissa and then Shane there.
You know what? My screen is not looking like it normally does, so I may be interfering. So whoever is next should go next.
I think Bev, you can go on and go, and then
Okay.
I'll,
Well,
I'll
I was making just a few notes while he was speaking, and the first thing I thought of when you mentioned the financial situation, obviously there's places around that will work with people, teaching them how to budget, and there are some free programs there. But he obviously works a lot, so he must make a good deal of money. Maybe he should keep a log of where his money goes. That would help him to see it himself. The other thing that you mentioned up front was some of this could be related to the death of his wife. There are grief counselors, and I think that might be a good place for him to go. And then somebody mentioned the use of the motivational interviewing, which I think is a really good tool to sit and have a conversation with him about how he sees his situation and what would he think that he should be doing before jumping into trying to give any type of advice. So, like I said, my screen looks really funny today. So I just wanted to make those few comments.
Thank you. Thank you so much. Yes, I really do love the motivational interviewing. And one of the things I really value is the strengths-based perspective, like highlighting his strengths and using that as a way to maybe guide some of his struggles.
And then Chris, was it Chris or was it Shane? I'm sorry. Shane, do you just want to go on?
I can. Thanks, Michael, for your presentation. I wanted to just, I have a lot of thoughts, but Dr. Cotton touched on this topic of shame. And like, I'm as a person in recovery, like, I mean, what I've learned about me is like, I was and can it sometimes still be a shame-based person, which is why I developed my addiction to alcohol. And like any sort of like maybe there are people that have addictions that don't have shame, but I haven't met one. Um, this is like what drives it. And also like grief, grief work, like it's just like recovery, like it's a process, not an event. And while I've been sober a couple years now, like I what helped me was a 12-step program. That's just what worked for me. But I also my first experience with that program was over a decade ago. And like seeds had to be planted along the way. And I don't know if this gentleman would be open to that, but it does work. Like I know there are other ways, but the book we read was written in 1939 and it's different from other forms of therapy because all those steps are written in the past tense because it says if you do this, this is what will happen. And like that's how I got this job. That's how literally how I ended up in this conversation with you guys was because I surrendered and allowed another human being to help me. And what happened, I'll just real quick, I'll wrap up with like I went to yet another meeting that I didn't want to be at. And I asked a guy to talk to me after the meeting, and he said, or I said to him 2 minutes into the conversation, something I've said to people my whole life, which was, "Hey, I know you got to get going. Thanks for talking to me. I'll see you around." And he said, "I don't have to be anywhere. What are you talking about?" And then he was like, "Hold on. I bet you think you're a burden to everybody, don't you, bud?" And I was like, "What?" And it just like, and the floodgates just opened, and I started weeping. And that guy literally saved my life because, see, he said I spot it because I got it. And that's what happens in those rooms is like you meet people who are armed with the facts about themselves, and they won my confidence like that. And he got me to uncover all this. That was a core belief that I carried about myself that I am
Yeah.
worthless. I'm not worth your time, and it's shame.
Yeah.
That's what drives this stuff. So I just maybe suggest you
I
try
I
it.
really appreciate you saying that because I myself I'm very I care about people and I've kind of gone out of my way to work with this client because he works late shifts. He tends to sleep more in the morning. And it was actually, I can tell that he needs more interaction with people because at one point I was calling him at like 8 o'clock at night. And he started crying. He got really emotional because he could tell that I was going out of my way to be there for him. And I think it's just those little things. Because even though I live in Washington State, he's in Kentucky. So, there's not a whole lot of interaction, but it's just those little things of showing up for somebody and showing them that you care, that you matter. Um, that you have value. I think those are things that he's that's been missing from his life. And like you said, Shane, like that really makes a difference, showing that somebody else cares for you is life changing.
Yeah, and the power of that program is it's for fun and for free, we say. There's
Yeah.
nothing to be gained from
Yeah.
it. All we want to see is you stay sober and not die.
I
Well,
do have
and it's
a
aggressive and fatal. Alcoholism kills us.
I have a follow-up question, I suppose here. So I I've tried to mention working with like a student therapist, and he seems resistant to want to work with somebody. So I even wonder if he would be resistant to some type of grief work. We haven't had enough time to really dive into those things, but I certainly think that maybe the motivational interviewing is something that I can try to work on and make things smoother for him.
Yeah,
I
listen.
think planting the seed is really important.
Yeah,
Shane, thank you so much for sharing all that you did. But I think, to Shane's point, sometimes you're planting the seed for the future. You might not ever see all the things for the individual, right, that are happening as you're walking that journey for them. But I think that's so important is to be the
so
starting point sometimes.
yeah, that's a great point. Thank you.
Listening for that change talk as you're using that motivational interviewing will be so important. Yeah. And to find out what's most palatable for,
Yeah,
it might be grief. It may not be an AA program yet. It may not be, but I think
yeah.
motivational interviewing is really,
I can tell, he has that light inside him,
Hmm.
like he has that willingness. I know it's there. I just haven't been able to. I don't think there's been enough time between the two of us to really develop that stronger relationship yet, but we're getting there.
Yeah. Yeah. Okay. Is there any other additional comments? Let's
Yeah,
see.
Melissa's had her hand up for quite a while, Pam.
Melissa, so sorry. Thank
No,
you.
that's okay. I don't have a whole lot to add. I think everybody we're really on the same page. If he's feeling overwhelmed, I think that maybe a good place to start isn't maybe a formal 12-step program or a formal therapy session. It may be if you could find a men's group for him. And it could be that they're dealing with, you know, financial trouble or grief and loss. And that's probably what you're going to find is more like a grief and loss kind of support group. And I think that that would be helpful to him to have people to talk to that understand him. You're going to have to look at age groups, obviously, for that, as Dr. Cotton mentioned. Um, Sitting him down with a group of 20 somethings and he's 53 probably will not be effective for him. But a group of men similar to him encountering similar issues, I think might be a really good beginning for him. I think too, there is a big place in recovery for reduction of use and harm reduction. I know that's not a popular term right now, but
Mhm.
harm reduction there it's huge. There's a big place for that, and so maybe talking to him about instead of 5 or 6, drinks, depending on what that looks like. Maybe we could do 2 or 3, and see how that goes and talk to him about reducing that use, and maybe replacing that with something else, such as a men's group. I asked some questions about whether he lived in an urban or rural area. And does he have a livable wage? And if he does have a livable wage, then someone mentioned a log and identifying where his money's going, I think would be a great plan. If he doesn't have a livable wage, then that is a huge issue, and that could be the whole crux of where his financial problems are coming from. He's working a whole lot, but he might not be making a whole lot. So I think assessing his income versus his expenditures, I think that's really important. Um, and in Kentucky, there are career centers across the state. So depending on where he lives, whether it's the Louisville area, or even in more rural areas, there are still regional career centers located across the state that he could, talk to about skill development, helping him identify maybe jobs that he would be qualified for that may pay better, and those types of things that to give him some direction on how to improve his financial situation. Someone else mentioned SNAP benefits and other benefits. If he's below poverty level or close to poverty level, he may qualify for some of those benefits. He may not want to apply for those, so that's something to explore with him, to see if that's something he wants to do. And I think I had all kinds of stuff going through my head, so
That's a
I
lot.
think that
Thank
that
you.
is um,
Thank you
Thank
so much. Like, I just want to quickly address that. So, you first mentioned about his maybe a men's group of some sort, and I was shaking my head. Absolutely, yes, because we've had that conversation. And when I mentioned something about um, working with a student therapist, he asked if it was a man or a woman, and he said that he feels way more comfortable working with a guy, that he's had some difficulties and he's just done some stress and I think he's had some sexual abuse in the past as well. That's so yeah, he wants to work with a man is kind of what his preference is there. So I definitely think mentioning a men's support group, I think that's a great idea. I really do like that. I think he would definitely I think he would like that. I'm not 100% sure. He's mentioned that he lives in Louisville. And so I'm pretty sure he just lives in the city there. I haven't been able to identify exactly um, which part. But yeah, I mean he working full time and picking up additional shifts, you would definitely think that he's making a decent amount of money. But like you said, I mean he might be at the po poverty line there, and I'm not really sure what his rent looks like. You know, he has a daughter that's in and out of the house. You know, maybe he's got, a fairly larger apartment that obviously costs a little bit more. So, I'm not sure. Um, but yeah, I think recommending the career center, that's a great suggestion as well. Thank you.
All right. Thank you so much. Thank you, everyone, for the conversation. Michael, thank you so much for the presentation of the case. And I hope that some of the recommendations today uh, turn out to be helpful. Thank you so much. All right, we're going to turn the microphone back over to Mona.
Okay, so I'm not going to really talk as much about KCHC as I normally do because I did yield some time to the great conversation that we was having. So I think we're in good shape as far as our conversation because what a lot we do when we're doing our KCH is to talk about what we learned and how we can share this information. And for the sake of time, I'm just simply going to say one of the things that we are all challenged with is how we can get this word out. And I'm not talking about just what's going on with Michael's client, but I'm talking about the substance abuse without offending and start educating our communities about how our bodies change as we age because as our bodies change, we can't drink and we can't eat and we can't move like we did when we were really younger. So we have to learn what we can do to be able to stay healthy. And that's some of the things that we try to do within some of our educational programs, such as Flourishing Together. And you can, I don't know who's doing the slides, but just go on over to the things that we're talking about. Let's start right here. My Health Matters is a free program every Monday night that we do by Zoom. And we have a lot of different types of speakers, as you can see with this. And this is just a good way for our communities to come together. And within this audience, we have professional, we have paraprofessional, we have community health workers, we have community members that just hear about it. And we really have a good time. So quickly, you can see that Sam presents for us occasionally. Emotional health awareness was great this past week. Or no, she's going to be doing that this week. There was another one she did not. Oh, actually, she did this presentation in a little abbreviated form for
Say,
us.
I think I'm on tap for this Monday.
Yeah, this is your Monday. The next
Come hang
Monday's
out with
mine.
me.
The next Monday I'm doing on spiritual awareness, and then the first Monday night, and this is one that I really like to encourage a lot of you to come to. I want to encourage you to come to all of them, but I have done this at a couple different conferences, and people have said this is something that everybody should hear, and especially our community health workers, because we are working with folks very often who are looking toward the end of life or in the end of life. So we're going to be talking a lot about how we can handle that. And I'm not going to go through each one of them, but as you can see, we do some really neat things. So please share this with other folks and you yourself try to come. So let's go on. We do diabetes self-management class, and we do have another class that's going to be starting on November 4th, and you can go on. And a Flourishing Together class we just started, and you can go on. I'm wanting to get to this part. This is the part that I really want us to talk about. Uh, on the drum roll. I really want us to get excited. And you say, why get excited about a walk? Well, this is something we have been doing for 14 years now. And I am so happy to say, somebody's knocking at my door. I am so happy to say that we have increased our steps by a great number. However, we are decreasing our numbers of counties. And I want you folks to help me with that because I want this to be a statewide. And as you can see this year, our large county was Jefferson County is our winner. Now, you know, that doesn't look like a whole lot of steps, but that's because no other large counties gave them any challenge. And so let's see what we can do to get going. On the medium county, Oldham County, look what they did. And Leanne is on. Leanne, would you like to share with us very briefly just what are some of the things that you did to come up with these kind of numbers? Can you unmute and do that?
Yes, thank you, Mona. Yeah, we had a great kickoff event this year, and I would like to say that really we get these numbers because we use our coalition, and a lot of people get involved, and that's what you have to do, right? You have to get the word out. And so our library, our extension office, we had for people who were unable to walk on our walkway, they offered a line dancing movement class at the same time. So a lot of different activities going on around the county. We also printed signs with the QR code that took you straight to Trager to enter your steps and put those at our parks to encourage people to count their steps and walk a little bit more than they did the last time. And so, and you know, it helps that you have a trophy, Mona. You know, everybody loves a trophy. So we put the trophy at our library and we made bags that said that we wanted to win this trophy. And so everybody to count their steps. And it's really a fun way to get the community involved. We call it Step Timber. That's instead of county walk, so the whole month, because you can, you know, count your steps for the whole month. And I had people emailing me, when's the last date? How can I put this in? You know, so just a lot of people got the word out. And like I said, using our partners is really important. It's not just one organization. It's a lot of them coming together and believing in this and knowing that, you know, if we're active community, we're a stronger community. So it was a great time. It's exciting to keep the trophy.
Okay. And actually, one of the trophies has been lost, so we decided we're going to start giving certificates. But hearing you say that, we may reconsider and replace that lost trophy. So thank you so much, Leanne, for sharing with us. Let's go on to the next slide, please, Justin. And I just came up with some ideas for a successful walk. And some of these came from our winner from the Trimble County, but she could not be here today. I kind of interviewed her. And she said some of the things that we need to do is to find an advocate that believes in the walk and time to market the walk. And I think that is really important as we're looking at bringing on new counties and even within Jefferson County, if we could find someone that actually has the time to lead this walk. Come together as a county to start and finish the month walking together. That's what we used to do years ago in Henry County, and we used to win it all the time. And then a lot of things happened and we quit doing that. And I'm thinking that we need to start that again because we really do want to get the trophy back from Trimble County. And they're not even here to defend themselves right now, but you can see they did a great job. Um, do come together. That's the important part. Just like she said, it's not one person, it's not one organization. Henry, Trimble, Shelby, and Odom are the ones that does the most steps normally. And they have worked with their libraries, their health departments, their schools, oh, what am I trying to think of? Well, I can't think of it, but anyway. So we want to share with all the organizations. That's the main point. Encourage them to do friendly competition within their organizations. Challenge organizations within your county. Hang up flyers where appropriate. Make a sign-in sheet for those who do not have a computer and share with the lead to enter. That's an important part. And I know Trimble County has really done a great job with that because they have a lot of folks out there that like to walk. The senior centers, that's what I was trying to think of. Our seniors really want to walk and be a part of the county. And they may give enough steps to make you get over to the next part. Check on other walks in the county during that time and ask them to share the state challenge with them. Steps can count for more than one walk. So if during September you are doing another walk, talk to those people and have them sign up because if they're walking for one entity, they can also walk for us. Remember, all activities count in this particular one, and we have formulas to convert the number of minutes or hours you spend in gardens, playing tennis, and so forth to steps. So I really want to encourage you to encourage different counties to join the planning committee for next year so that we can truly go straight statewide. That is our hope, that this can really become a statewide initiative. We love our KIPTA region, but we want it to be statewide. Okay, next one. Okay, whoever it wants to talk about that may.
So I'll just say briefly, if you really want to learn more about caring for older adults, we encourage you to join our Optimal Aging Scholar Program. By attending a Project Echo session, you've already marked off one of the requirements, but the other requirements are here on the right. We have a great series of online modules. We host an interprofessional case management experience. We have a half-day workshop called Impact 4M that really takes a deep dive into the 4Ms of healthcare that Pam mentioned earlier. And then we ask you to participate in our Optimal Aging Conference. You can always contact me and I can get you in touch with the coordinators. So we would love to have your participation.
Is Barbara doing this one or? Well, I've not seen this slide before, but I'll go ahead. We do have our community initiatives, which is our Flourish Care Centers of Excellence. And right now we are working with the KIPTA region, the Cumberland region, and the Barren River. And what we're going to be doing is working together on how we can come up with strategies to improve coordinated care with older adults. And what's really happens a lot of times is that move when they go from a hospital to a rehab center or home, there's not good follow-up care. And a lot of times we have a lot of problems with medication errors and such as that. And we also want to collaborate with the state and local government, the healthcare systems, the academic institutions, and community organizations, as well as older adult community members and caregivers. So we do have meetings monthly or quarterly. Which is it, folks?
It's monthly.
Okay.
It's called our Flourish Care Centers of Excellence Steering Committee meeting, and those sites are located at the Barren River region, Cumberland Valley region, and then KIPTA. They are. I know for the one for Cumberland Valley, it's the last Wednesday of every month from 1 to 2 p.m.
Okay. And I think the other ones are probably varying Wednesdays, and you can also join by Zoom. And if you have an interest in this, and we say please have an interest in this because we want to take care of our older adults in the best way that we can, you can let Justin know, and he will make sure that information gets to the right people. You want to go on, Justin? Okay, so these are some of the other programs we have. Our Flourish program is a program that is designed to help adults with multiple chronic conditions to prove life satisfaction through a comprehensive care navigation program. And you saw just a little bit of how that works today with Michael being able to help us with the case study. We have a caregiver problem. We have a caregiver program for those who are caring for aging adults that are 60 and above to provide support and resources. And again, if you fill out this survey, someone will contact you very shortly. It is a great program. I used it recently, and I know that it really does help. Virtual friendly visitor. This is designed for those who may be lonely or isolated, and they will be able to get some home calls. And then our Pearls program, this is to rediscover our joy and purpose and connection with our program to encourage active, rewarding lives. And this is a really good program for folks who may be having mild depression and have some loneliness. And it's a good place to start. Of course, they are trained to know if someone needs additional help and will make appropriate referrals, just as they will with the virtual friendly and caregiver program. Okay. Okay, so I'm going to leave the pledge because I know we're running just about over time and we don't want to do that to you because we know how busy everyone is. So I'm going to yield it back.
Thank you, Mona. So I hope you join us on November 21st for cognitive decline and dysphagia and our session evaluation. Remember, if you want community health worker or social worker continuing education, you must complete a survey. I put the survey link in the chat. So please complete your surveys, and I hope you have a great weekend.
Thank you, everyone. Thank you so much for coming.